Hi, this is Dr. Donald Pelto. I want to go over today something called a ganglion cyst. A ganglion cyst can be found in many parts of the foot. Here's an example on the top of the foot here, a little bump that sticks out. Another example on the top of the foot right here. And also here's an example of a cyst on the big toe joint. Kind of could be confused with a bunion. So let's talk a little bit about a ganglion cyst. So first of all, what is not a ganglion cyst? Because people get these confused many times. On the bottom of the foot, there's a course of a ligament called the plantar fascia, or is a fascial ligament that goes, and sometimes there can be a little tear in there called a plantar fibroma. It feels like a soft tissue mass. Sometimes if it's really, really hard, it's probably a fibroma, but sometimes there could be a ganglion, so you have to really determine if this little mass on the bottom is a ganglion cyst or a fibroma. The best way to tell is by puncturing it and trying to get some of the liquid out of it. Also, you want to be careful of a bunion. Here's a bunion caused by a big bump, a little redness here from rubbing on the shoe, but along with this, sometimes there can be a little bit of a cyst that can develop around this area that can come from the joint. So what are the causes of ganglion cysts? Ganglion cysts can happen spontaneously. They can go away spontaneously, but typically there are two causes. They can either come from a joint or from a tendon or tendon sheath. So here's a really good example here. You can see the ganglion. Okay, there's a little stalk, kind of like a straw, and then there's a balloon that fills up. So this can either come from one of the joints where it gets a little hole in it and then fills it up, or it can come from one of these tendons. All of these tendons, they have a sheath that covers it, and there's some fluid in there to help it lubricate and move back and forth in the tendon sheath. And if that gets a little puncture in it, it can create a little ganglion cyst. So the struggle is first trying to determine where it's coming from. An X-ray or MRI can help you. And then also figuring out if you can make it go away on its own, or if you need to go in there and surgically remove it. Here's an example of one on an MRI. You can see the color difference than the other things on the MRI. A specific type that's seen in the foot is called a mucoid cyst. Very similar, just different name to it. Usually it's seen at one of these little toe joints. So in a toe joint, you have a proximal joint and a distal joint. And many times it happens at this distal joint where you get a little bit of a cyst that keeps coming back. You can smash it, it'll come back, smash it, it'll come back. And then sometimes you need to remove. Here's an example as well right here. Let's go talk about diagnosis. How do you determine? You can examine it. If you can feel it and it's nice and soft and it's movable, it's probably a ganglion. You can aspirate it with a needle and pull out some of the liquid. That'll help you verify. It looks kind of like a gel that would come out, or you can get an MRI that can help you determine how large it is and where it's coming from. And then for treatment, usually first time someone comes in, we may watch it as long as it doesn't bother someone. If it really hurts them, we can try to aspirate it. That's where you pull out the liquid, and then you inject cortisone in there to try to shrink the actual sac and have it close off the stalk where it's coming from. Book therapy, that's where you actually take it. There's a little one right there on someone's hand, and you smash it. So people smash it, pick it, have it, get rid of the cyst material, the ganglion material, and then it may fill back up, or it may spontaneously go away. If all of that doesn't work, then the next option would be to do a surgical treatment of removing it. Here's an example of a cyst that's being removed. You try not to pop the cyst, but many times it does pop as you're pulling it out, and you get the cyst fluid. And then you have to try to go down and try to find out where the sac is coming from, where it's coming from. Here's an example of a mucoid cyst of one in the toe. And sometimes you have to do a little bit of a skin flap to cover it because there's not much flexibility. Sometimes you have to shave down and grind down the bone because sometimes it's coming from the joint, so you need to fuse that joint so it doesn't come back. So that's some information about ganglion cysts. If you want to learn more, there's going to be a link you can follow to learn more on the patient handouts that we give our patients here in the office.